For anyone who really struggles with breathlessness, portable oxygen seems like such an obvious fix, right? Like a ticket back to an active life. But what if the official guidelines and the actual real-world evidence tell a completely different story? Today, we're going to break down the super surprising recommendations for ambulatory oxygen therapy and see if it's really the lifeline we think it is, or if it's maybe just a heavy burden. Okay, so let's just start with what feels like common sense. I mean, if walking to the car or just doing some chores leaves you gasping for air, it just seems logical that carrying oxygen with you would solve that problem. It feels like a simple one-to-one solution. But as we're about to see, this very logical assumption is exactly what the clinical guidelines are pushing back on. And there it is. Right out of the gate, straight from the British Thoracic Society, this is the core recommendation, and honestly, it's kind of shocking. It says that for patients who don't already need long-term oxygen at home, this portable, on-the-go version shouldn't be the standard treatment. And that immediately creates this big puzzle. Why on earth wouldn't we give oxygen to people who get breathless when they're active? So, before we get any deeper, let's just make sure we're all on the same page. When we say ambulatory oxygen therapy, or AOT, we are talking specifically about using those portable oxygen tanks or devices while you're moving around, during exercise, running errands, you name it. Basically, anything that isn't just sitting still at home. It's oxygen that's designed for life in motion. Okay, but get this, because this is where it gets even more interesting. The guideline doesn't stop there. It's not just for people who aren't on home oxygen. Even for the group you would absolutely expect to need it, patients who are already on long-term oxygen therapy, the recommendation is the same. AOT is still not routinely offered. So, this really raises the central question for us today. If it's not routinely for either of these groups, then who in the world is AOT for?
Right. To understand this, we've got to break down how the guidelines actually think about patients. The whole thing is split based on two very different groups, and understanding the difference between them is absolutely key. So, first up, you have patients on what's called long-term oxygen therapy, or LTOT. Now, this isn't about feeling breathless when you move. This is a life-sustaining treatment for people whose blood oxygen levels are dangerously low even when they're just sitting still. For them, oxygen is a must-have for at least 15 hours a day, and it's usually delivered by a machine at home. Okay, so let's put these two big recommendations side by side so we can really see it. On the left, if you are not on long-term oxygen, AOT is not routinely recommended. Pretty clear. On the right, if you are already on long-term oxygen, AOT is, you guessed it, also not routinely recommended, with this tiny little exception that it might be looked at after a special assessment. So what is going on? Why are the guidelines so hesitant about something that just seems so helpful? Well, the answer is hiding in this really fascinating paradox in the clinical evidence. There is a massive, and I mean massive, difference between what happens in a controlled lab setting versus what happens when real people try to use this stuff in their actual, messy, day-to-day lives. Let's start with the lab. Okay, picture this. Researchers bring patients in for one single controlled test. Maybe they have them walk on a treadmill for as long as they possibly can. When they do this, giving them ambulatory oxygen looks like a total game changer. The results are super clear and consistently positive. And we're talking about some pretty significant benefits. During these short tests, AOT helps people go longer and farther. They can handle a tougher workload, and this is a big one. They report feeling less breathless while they're doing it. I mean, based on this evidence alone, you'd think every single person who gets breathless on exertion should get a prescription, right? But, and this is the crucial point, when the researchers send these same patients home with all the equipment and tell them to use it for weeks or months in their real lives, the whole picture just changes. Those amazing benefits that we saw in the lab, they often just poof, vanish. And this is where the story gets really, really telling. In a big 12-week study, patients were given portable oxygen to use whenever they felt they needed it. And on average, people only used it for 40 minutes a day. 40! That suggests that the reality of lugging it around, managing the tubing, and just the hassle of it all, it creates this huge barrier that stops people from actually using it. And the final verdict from that real-world study was just stark. Compared to a placebo group that was using a tank filled with just regular compressed air, the patients with the actual oxygen showed no significant improvements. Not in their quality of life, not in their ability to function, not even in their breathlessness.
The benefit that looked so good on paper just didn't show up in real life. So after all that, you might be thinking, is AOT ever a good idea? And the answer is yes, sometimes. See, the guidelines aren't totally rigid. They have some specific exceptions where a doctor's judgment can override that general rule. These are what they call good practice points. And what they do is acknowledge that, you know what, for some specific people, in very particular situations, AOT can actually be a really valuable tool. The key thing here is that it's not a gut feeling. It requires a formal individual assessment to prove that the benefit is real and that it actually outweighs all the burdens. So who are these exceptions? Well, first, there are patients in a structured pulmonary rehab program. If a test shows that oxygen helps them exercise better, great. They can use it to get the most out of their training. Second, some patients with specific conditions, like interstitial lung disease, might get unique benefits. And finally, for those patients already on long-term oxygen, it can be used for really practical reasons, like making sure they can get to a doctor's appointment, or just to help them hit that crucial 15-hour-a-day target that's been proven to extend life. So after all of that, what's the big idea? What's the one thing you should really walk away with? Let's boil this all down into a clear, simple takeaway message about ambulatory oxygen. Okay, if you remember one thing, make it this. Ambulatory oxygen therapy is not a simple one-size-fits-all solution for feeling breathless when you move. It's just not. Think of it more like a highly specialized medical tool that only really works for a very select group of patients in very specific situations. Its success is all about matching the right person to the right circumstance. And that brings us to how this should be approached. First, any potential benefit has to be proven with a formal test, not just assumed. Second, that measured benefit has to be carefully weighed against the real-world hassles, the wait, the inconvenience, maybe even the social stigma. And finally, this isn't a one-and-done decision. You need regular follow-ups to make sure the therapy is actually still helping and hasn't just become another piece of equipment gathering dust. Which kind of leaves us with one last big question to think about. When we see this huge gap between how promising oxygen looks in the lab and how little impact it has in real life, what's the bigger problem here? Is it the heavy, clunky equipment that just makes it too hard to use? Or is it our own expectations, our own common sense belief that there should be a simple fix for a problem as complex as breathlessness? The guidelines seem to suggest that the truth is probably hiding somewhere in the middle.